I am Lai Yunying, student number 190055175. Good morning, everyone. Today, we are going to talk about occupational health. Do you know what is occupational health? Does it only mean safety working environments? According to the report of the World Health Organization, occupational health is a multidisciplinary activity aimed at preventing and controlling occupational disease, enhancing well-being of workers, and promoting healthy and safety environments. And from the World Health Organization, the predominant view of occupational health are interaction between work and health, positive health effects of work and health workplace economy, and sustainable development. For now, let me mention some common health problems of construction workers. The biggest concern must be prolonged outdoor working environments. It will increase the chance of having dehydration, and it is hard to drink water while they are controlling the machine or doing their tasks. Plus a long working hours and lack of regular exercise, it will increase the chance of having non-communicable disease, for example, hypertension and stroke. Second, as they always work irregular in time, they will prefer a fast meal. This kind of meal always lack of essential nutrition and high in unhealthy component, for example, high in fat and seasoning. This may create an unhealthy eating habit. The third is mental problem. Construction is a high-intensity work which requires high concentration and consuming lots of energy. That may increase the stress and tends to have anxiety, headache, and gastric ulcer. In addition, as the construction workers having different kinds of stress that I have mentioned as the previous slide, an unstable income is one of the factors that create stress. It is because most of the construction workers do not have a stable salary, like monthly wage. The most common payment method is daily rated or piece rated, which means that the workers earn by how many work they do and how hard work they are. This unstable income may increase the stress to their quality of life and family. Besides, some of the construction workers may choose to use some negative relaxation, for example, alcoholism and gambling. Even though the construction workers do not precipitate those negative habits before, they usually will have influence by their co-worker, like secondhand smoking. These are the health problems of the construction workers.
I am Hong Yut Kun, student number 190030804. I will illustrate construction workers' health in a holistic way. Construction work is a manual, heavy work, so the physical status of worker would suffer the most. According to a study conducted by Albert Chen and Wenyi in 2016, 41% of participants claimed to have experienced at least one musculoskeletal disorder symptoms in the past 6 months. Low back pain was found to be the most frequent symptoms among construction industry. The main causes for work-related musculoskeletal disorder symptoms may be attributed to the repetitive manual activities, such as transporting, lifting, or moving heavy materials. The prolonged exposure to unwanted noise and uncontrollable vibrations would cause loss of concentration in work or fatigue and stress, which leads to a poor health conditions and increases the risk of accidents. This may harm the worker's mental health. Financial health is the state of one's financial situation. There are many dimensions of financial health, including the amount of savings you have, how much you are putting away for retirement. Though the average daily salary per hour of a construction worker is higher than the median hourly wage, due to the uncontrollable income that Coco had mentioned before, there is still a fluctuation in construction workers' financial health. Workers in a construction site may be exposed to various hazardous substances like lead, and there are air contaminants and dust in working process. This may harm the workers' environmental health also. So we will now discuss the interaction between different dimensions of health in terms of an example. Peter is a construction worker suffering from chronic illness and pain. This causes him cannot perform certain posture like bending down to pick up bricks. He needs to use other equipment to help him finish the task, which is more time-consuming and leading to a low productivity. When comparing to other more healthy and higher productivity workers, Peter has a low business competitiveness. The employer may think Peter cannot finish the work well, therefore offer less work to him or maybe ask other employees to finish Peter's work. This may affect Peter's financial health and successfulness. Peter may feel others are more superior than him and he is not as good as others. And the low productivity may cause him to be dismissed from work. Construction work is an energy-consuming job and make Peter feel tired and less willing to hang out with friends or family. Moreover, construction workers is not a 5-working-day job. Thus, Peter cannot enjoy the same free day as friends and families, which reduces the time that he could spend with his loved ones, and this may harm his social well-being.
I am Chan Chimpui, student ID 170034645. So there are some roles of lifestyle that for construction workers. First is maintaining a healthy diet. According to the research of Cancer Prevention Center, the major risks factors that have been proved to contribute to chronic disease are unhealthy diet. Moreover, that should be consumed more. So besides, exercise is an important part of a healthy lifestyle because it helps to burn off excess calories. It is good for strength and flexibility, and it also releases a few good endorphins in the bloodstream. Also, exercise is also a good way of boosting the metabolism and promoting healthy weight loss. So now I will talk about how nurturing care applying to the construction's occupation safety. So before it, I will want to introduce what is nurturing care. So it is first of all, it is referring to the conditions created by public policy, programs, service to enable communities and caregivers to ensure their target to have good health, nutrition, and to protect them from different threats. So hence to provide opportunities for early learning through interaction that are response and emotionally supportive. So there are five components. There are five components of nurturing care. The first one would be good health, and second one would be the adequate nutrition, the responsive caregiving, security and safety, and the last would be opportunities for early learning. So we are going to focus in how different situation affects the health conditions of the construction workers. So the first one would be the conditions created by the public policy. So it is a component in the security and safety. So there is a health and safety policy in the construction industry. So for example, it explains who is responsible for specific actions to assist effective management of health and safety. Moreover, it provides a duty of care which protects employees and let the employees to know what is their responsibilities in standing in the standpoint of safety during their works. So construction design and management (CDM) is a program which allowed construction phase to have a different plan. For example, records arrangement, hence to manage significant health and safety risk factor of the workers. So the second one will be the health condition created by programs. So construction industry council have organized a guidelines of the implementation of P&N caring program. So this program is to summarize different experience from constructors in implementing the caring program. So hence to collecting more information and issues from the industry, hence to formulating and evaluating the result, tends to protect and simulate some result for program to help to provide the security of the workers. And the last one would be the health condition created by the service. So financial help for current and former construction workers. Government provide fundings for workers to maintain opportunities to join the public service. Hence, not only provide for workers but also the family members, and available for workers. Family members who face the allowed salaries. For example, the Charting Institute of Building Beloved Fund. The second will be the Building and Civil Engineering Charity Trust, and the last will be the Lighthouse Club. So these three services are helping workers' families specifically.
I am Yun King Tong, student ID number 19003201.
I'm Chan Shin, student ID is 190053662.
We are going to talk about how nursing fit into healthcare system. The aim of nurses are to develop the people's ability to control their own health status. By providing education of nursing care, they can reduce the possibility of being hospitalized. During the education, they will learn some technique, information about disease, and increase the quality of life in order to achieve holistic care and high-level well-being. Below, we will divide into three parts, namely education, promotion, and communication, to explain about it. Lufia, could you introduce some example of education first?
Sure, collaborative intervention is one of the examples. Referring to the patient situation, nurses can advise doctor to carry out that patient with other health professionals. For instance, construction workers may have bad body mechanics when bearing the heavy items, secondary to spinal disc herniation. During the recovery process, nurses can advise transferring patients to physiotherapists who can teach them good body mechanics. Apart from that, based on the nature of construction workers, they always work outside. Due to the time limitation, they tend to ease take away. Moreover, owing to the loss of large energy during the working process, they are inclined to eat more meat because an unhealthy and balanced diet may lead to getting diseases easily, such as rectal cancer. Therefore, nurse can advise transferring patients to dietitian who can teach them healthy diets. In these cases, the role of nurse is follow-up treatment. Joseph, do you have any add?
Of course, another duty of nurses is to provide information for patients. For example, some construction workers may suffer from deafness due to their working environment. Nurses are responsible for getting detail which patient can face up to this situation, such as applying the compensation of occupational deafness. Nurses can also teach their relative about the care after discharge. For example, nurses can teach their relative to take care of patients who get fracture by moving laser and assessing the hurting bone. Moreover, according to above mentioned, patients may have mental problems such as depression. Nurses can provide relation technique, for instance, breath focus. Breath focus can address heart rate to normal and emotion. Moreover, gliding imagery can recall fantastic short-term and long-term memory. Both intervention can be less days work. In this case, the role of nurse is an educator. So what about the nurses can do in the promotion?
Well, nurses may hold a talk offering information about occupational health for new blood, such as what is occupational diseases, good body mechanics, healthy diets, and so forth. This can raise people's awareness of occupational health. Upon the health talk, nurses can also provide the knowledge of prevention to reduce the opportunity of getting occupational diseases. Furthermore, nurses can continuously upload the latest medical service announcements about the occupational diseases onto official websites, where showing the reasons causing diseases, symptoms, individual at risk, and the therapeutic plan. Based on the information nurses release, people may know the severity of occupational diseases. It can encourage them to receive medical treatment. In these cases, the role of nurse is disease prevention. So what can nurses do in the aspects of communication?
To start with, nurses can be as a bridge between patient and doctor. Sometimes doctor may say professional keyword of the disease, but patient cannot understand the professional keyword, resulting in medical error. At that time, nurses can express the word more simply to make them more understanding about their health problems. Therefore, it can reduce medical error. Compared to the case that doctor directly explain to patient, the intervention of nurses can lead more positive outcomes. In this case, the role of nurse is clinical practice. Okay, Lufia, what is your opinion?
Apart from that, nurses have more opportunities to communicate with patients. They can understand and know more patient situation. As the above mentioned, the payment mode of construction workers is daily or piece-related, leading to working stress. The unstable income may influence their emotions. If nurses have patients listening to them, nurse may understand more about their situation and further to fulfill their demanding. For instance, nurses can advise patients to find social workers solving their economic and emotional issues. So not only can nurses care patients' physical problem, but also psychological problem. It can achieve high quality and holistic care. In this case, the role of nurse is holistic nurse or facilitator. So for now, we move on to discuss approach in delivery of care and the difference between local and international.
I'm Ouyang Meiwa. Now I will move on to talk about the local and international approach in delivery of care. Firstly, let us look at the public policies in Hong Kong. In the areas of legislation and law enforcement, the government is responsible for enacting and improving legislation, as well as providing sufficient resources for conducting inspections. The Labour Department and Occupational Safety and Health Council work closely to help enterprises cultivate their own workplace safety culture. Advices are provided to help enterprises understand how to comply with requirements and providing advisory services with regards to OSH. Training and education accredit and monitor safety training providers, organize courses, seminars, and workshops. Standards and guidance, compliant guides to legislation and codes of practice, and safety culture is promoted through mass media and other channels. Other supports such as conducting researches and providing safety audit and consultancy services are also included. Professional bodies and concern groups can also make contributions in the following areas. All this shows that there is enough legislation and multi-sectorial cooperation in Hong Kong. Then we will look at the safety and health culture in Hong Kong. It is easier for construction workers to acquire OSH information nowadays. A study has indicated that workers are more concerned about the availability of first aid equipment, personal protective equipment, and health and safety guidelines, meaning that workplace health and safety awareness, attitude, and knowledge were elevated. However, in some small companies, work progress is more important. OSH problems are usually ignored even they exist. This shows that OSH is not an important issue in small companies. In the developed countries, there are regular inspections on working environments to ensure implementation of guidelines. Advanced machinery and equipment for materials handling are available and PPE are properly used. New workers can receive orientation or instructions, and therefore there are more trained staff and representatives. Overall, developed countries have better management, more budgets, and enough education. The safety and health culture framework in developed countries is similar to that of Hong Kong, with only fairly two differences. They are more intolerant of poor construction health and safety. Enterprises and employers are more cooperative. Developed countries emphasize more on occupational safety and promotion. Secondly, let's take a look at the developing countries. There are much more problems than the developed countries. The first problem is inaction or destruction of demands, which assign low priority to occupational health. Underfunding and poor economic use initiatives that propagate toward improved occupational health. These are ignored by higher authorities and trade unions. Corruption among the workers regarding implementation of occupational health-related programs is common. Sometimes public and private officials generally use power to suffocate occupational health measures. The forceful shift of workers not only affects their living and working conditions, but it also might be the probable cause of the very precarious situation today. When compared with Hong Kong, developed countries do not have sufficient resources in management commitment, supervisory environment, and training and competencies level. From the above table, we can see that in South Africa, there were differences relative to the dominant cause of accidents resulting in injuries in terms of frequency rates when compared with that of Singapore. The cause of accident not found as a common cause of accident in Singapore was working in awkward postures and positions, losing balance, slipping, and tripling. It was mainly related to body mechanics. The problem is preventable through education. Therefore, we can see that workers do not have enough education and awareness. Safety and health culture are not well developed in developing countries. To conclude, the approach in delivery of care in developed countries is better than that of the developing countries. Yet, there is still room of improvement. For the developed countries, existing health and safety rules should be improved. Placing effective risk prevention strategies in small companies and tackling new and emerging risks without neglecting existing ones are also in the agenda. For the developing countries, the government should build and enforce occupational health standards and legislation. Different organizations should cooperate to reduce non-recognized occupational and work-related disease to limit workers' exposure to new and known health hazards. What is more important is more education should be provided. Now I will pass it to Joey to tell us more about the roles of nurses.
Thank you, May, and Shomi and Joey. The following I will compare the delivery of care mainly in nurse and local with Australia and America. Nurses have a common role among these three countries as a reference person. They share same responsibility, which are provide health education, information to patients, refer patients to the health care that they need, and being a coordinator among different professionals when delivering the healthcare plan. This is a very important role that helps delivering a comprehensive as well as a unique healthcare to different patients. When talking about nurse on construction sites, both Hong Kong and Australia have specific position of site nurse. Similarly, they provide first aid when the site workers getting injury, while site nurse in Hong Kong would give the pre-hospital healthcare service, provide occupational health and safety, conduct body check and assist in investigation of accident, while for nurse in Australia, they would give professional monitoring on site workers' health and maintain all essential medical records, while they have no site nurse in America. Site nurse is also important, as giving immediate care when accident appears help reduce the seriousness of injury and the progress of rehabilitation. In the scope of occupational health, all three countries have occupational health nurse, in short term OHN. OHN in Hong Kong will face a different working environment and give talk to those workers what they can pay attention in their workplace. They will plan the protective measure to specific working environment. For OHN in America, will also be giving prevention measure, monitor worker health status, observe and assess their workplace. On the other hand, they will also handle injury, provide care to both mental and physical problems. They will conduct research too. For OHN and Australia, they will also provide health education, nursing care, monitoring, referral, first aid, and follow-up treatment. For occupational health clinic or service, Hong Kong would provide comprehensive medical and rehabilitative service which facilitate the recovery. We found that Hong Kong occupational health clinics are mostly provided by the government. They focus on secondary and tertiary health care, while occupational health service in America and Australia are mainly provided by private organization. Employer need to pay for the plan, and they are more focused on primary health care like drug testing, managing workplace safety. They also provide medical and injury management too. In conclusion, to improve the healthcare delivery system, in short term we should have safety policy enforcement with multi-sectoral support and cooperation. In long term, more healthcare workers should be educated and trained up. Last but not least, an appropriate health and safety culture should be developed too. This is the end of our presentation. Thank you for listening.